Our next session is a thought leadership session, looking at beyond physical fitness, the critical intersection of mental, behavioural and physical health in the aged care sector. So picking up that idea of whole person care. This is one of our opportunities to win that wonderful prize today. So if you haven't already, scan that code there to be able to win some points. We'll leave that up there for you. And our speaker today is from Suremploy, the General Manager, Victor Ahipene. Victor is an entrepreneur. Victor's entrepreneurial spirit fuels his passion for occupational health, leading to significant advancements in the industry. Originally from New Zealand, Victor has climbed the ranks of Suremploy, starting out as an assessing physiotherapist. Over his tenure, Victor has conducted over 5,000 pre-employment assessments, contributing to the development of safer workplaces and healthier workplaces. Now serving as GM, he applies the wealth of his experience to guide the continual evolution of Suremploy's pre-employment model. Thank you, Victor.
Is this a scanner? Yeah. Maybe. We'll go down here just in case. Thanks for the welcome, and just like to, as a proud Indigenous Māori, like to acknowledge the custodians of this land for allowing us to all meet, join, and evolve how we approach the aged care sector. And although not quite as witty as Uncle's proverb, I'd like to start with one as well. It's a Māori proverb, and a young man asked an elder, what is the most important thing in the world? And he answered, he tangata, he tangata, he tangata. It is people, it is people, it is people. And that's something that I'm looking forward to exploring in this presentation today, about the people that are looking after our residents and the people out in the community, and exploring what we've learnt with over 100,000 screenings of staff in the aged care sector over the last couple of decades. But exploring, I think across this room, it's become year on year more accepted that screening applicants in some way for their physical fitness, their physical capabilities versus the inherent requirements of the role has become an ingrained and needed thing, with high premiums, high lost time injuries in the aged care sector. It's something that we have, it's become more ingrained. What I want to explore today is where the physical, mental and behavioural aspects of those all intersect, and hopefully be able to inspire some learning and some discussion off the back of that. And so here's I chatted to my good friend ChatGTP and asked it to create an image, because I think being able to have a bit of a platform to start off to understand how this intersection works, I thought I'd start with a faux case study. So I asked for a photo of identical assistant nurse triplets in the aged care sector, and it came back with this, and apparently assistant nurses like wearing stethoscopes, and I think if you look close enough there, they also gave them identical triplets to care for in the background of the image. But part of that example is, although these three ladies may look identical externally, physically, mentally and behaviourally, regardless of if we're identical twins or triplets, we are all slightly different. And this is the exact same case as, are you seeing with the people that are coming in your front door, the physical aspect, which I touched on, many of you are looking at that, but then also obviously the mental and the behavioural aspects of those clients, because I guess when you're able to start reconciling and seeing those things, just like the Titanic, if it was able to see that iceberg, probably wouldn't have crashed into it. You can do things to be able to support, avoid and create a healthier, safer workforce. So let's have a look at the first sister. They've all just graduated, and they all came through one of our clients who had screened them for both their mental function and their physical injury risk. In this case, the first sister, she'd actually had an injury that she hadn't recovered completely from. So she was a high risk of injury relative to the inherent requirements of the role of an AIN. Mental function-wise, she had suitable mental function for the role compared to peers within that role. So to give a little context, we look at, in our psychometric screening, certain aspects of resilience, empathy, safe work practices, and non-aggression, and they're compared to both the general population and then with roles with high volume that we've seen high volume, it's compared to their other peers. So is she above, below, or on par in overall, and then in certain aspects of that. For sister number 2, she was the opposite. She had she had the capacity and the capability to be able to physically complete the inherent requirements of the role, but in one particular subset of the mental function or the psychometric screening, she was shown to have low resilience. And then the third sister was a combination of the two from a mental and a physical function side, where low mental function in certain areas, and then also a mismatch between the inherent requirements physically and what was required for the role. So let's zoom out and say, what would be the ramifications for you as an employer if these applicants weren't screened? What would that look like if these 3 ladies walked into your organisation? Obviously, there's no crystal ball on if they would or wouldn't get injured, but let's say they're all at a higher risk based on the screening. Looking at the first sister who had the high physical injury risk, if she was to go on and have a lost time injury, and at Safe Work tell us that the average claim cost is over $15,000 in this sector, which for most of you would be then paid for 3 years running. So we're looking at close to $50,000 in associated premiums for that particular worker. On the other side, if it was a primary site claim, although these make up a smaller percentage of total injuries for the majority of industries, the length and the cost is 4 to 5 times more than a physical injury. So you're looking at in excess of $50,000 for a primary site claim. And this doesn't even consider the other ramifications there are on your workplace, the culture, staffing requirements if these people are off or on suitable or light duties, but also the ramifications on you've got a worker who is physically or mentally unwell, and the ramifications on their family, on their community, and obviously on them. And the third sister, obviously, as a combination, would be a physical injury risk, and what we've seen is that there's a increased likelihood of that progressing to a secondary site claim. So let's say you've gone through the screening process and you have been able to identify these areas where there's some further investigation required for your hiring decisions. What would that necessarily look like for you as an organisation? From the physical risk side of things, there's the opportunity to find alternative roles within your organisation. There's the opportunity to potentially limit the tasks that they complete in that within your organisation or for that role. Oftentimes, those are going to cause undue hardship upon you, basically hiring somebody on a suitable duties plan. If somebody isn't able to squat to a certain depth or lift or move their arms or bend repetitively, then there potentially aren't going to be suitable accommodations that you can do as an employer. For some of those there are. From the psychometric side of things, though, being able to identify and then support these workers if they've potentially got low resilience or empathy or low learning confidence, you're being able to identify, screen and support those things, and we'll touch on different ways to both identify and support later in this presentation, but being able to look at those particular things and actually have goalposts to work towards when you're getting them in the front door, I think is invaluable. And then obviously with that third sister, it'd be, again, some sort of combination of the two. Now, over the last 12 to 18 months, we, both from clients that we work with in the sector and also industrial lawyers that we work with, we initially heard rumblings 12 to 18 months ago of gentle knocks from your compensatory bodies about psychosocial risk compliance. You know, are you being compliant? And it's now turned from gentle knocks to them barging in through the front door and checking on where you are at with that. Now, this isn't designed to be, hey, here's the exact boxes that you need to tick to be compliant, but at the same time, if we zoom out and rather than looking at what do you need to do to be compliant, more so what do you need to do to create a safe, supportive work environment at the individual level, I think being able to look at it in that sense, which we'll explore, a lot of compliance takes care of itself on the back end of doing the right things for the individual. And so where does this intersection occur that we've been talking about? We look at it in three different sectors of the physical, the mental and the behavioural, and the what we call our 360-degree insights. From the physical aspect of it, we know that 2/3 of musculoskeletal strains and sprains are walking in your front door as pre-existing underlying conditions. That means that, with the no-fault system that we work within, that you're taking on that inherent risk, and if they get injured, it's coming back onto you. And then also as a duty of care side of things for the employers that you're bringing on, are you potentially putting them in harm's way by bringing them on if they do have underlying risks or pathologies when they're walking into your organisation? On what I think is a really interesting intersection is, where does this, you saw those sliding scales, where does the physical and the mental behavioural risk overlap? What we see is there, and the data supports this, there was a study looking at mental illness in the previous 12 months, and those who had chronic, there was a correlation of 40% of people who had mental illness in the previous 12 months had a chronic physical condition. And so we've seen very, very similar with the way that we screen physically, and then overlapping that with the mental and the behavioural side of things, is being able to see it very much correlates that some of those applicants that we're finding have a mismatch between the inherent requirements of the role and what their capabilities are also having what, similar to that third sister, they're having the low mental function, and at pretty similar rates. With the other side of it is being able to look at low resilience in particular. So I mentioned we look at 4 different scales, and within resilience there's 10 different things that make up the resilience scale that we look at. But adjustment disorders from a psych side of things, and granted I'm a physiotherapist, so I won't dive too far down this rabbit hole, but WorkSafe Australia has shown that 92% of adjustment disorders are correlated with low resilience. So being able to identify and support, again, those applicants as they're coming in the front door is going to potentially save both you and the worker potential harm, stress, and create a safer workplace environment. Now, this 360-degree insight is, I guess, the combination of the physical and the mental and behavioural, but what we've found is really, really interesting, and we have forensic components built into our psychometric tool. So it was specifically built for the pre-employment space, and it was developed off the back of a lot of the Royal Commission into aged care, so looking at non-aggression with employees and safe work practices, etc., to be able to obviously create safer work environments and safer conditions for residents as well. But part of those forensics will also show us, are applicants disclosing information? It looks at, are they overstating? And in a pre-employment assessment, people are going to try and put their best foot forward because it's in their best interest to. Are they overstating their abilities and capacity? And then also within the musculoskeletal questionnaire screening tool that we have, it looks at, are these applicants disclosing information? We call it disclosure. It's developed to be able to get people to tell us, as physiotherapists, we're used to having people coming into a private practice and saying, oh, I've got a sore neck, it's been going on for this, and this, and I notice it with this. With the traditional pre-employment model, a lot of the time it's, have you ever had a back injury? And people will inherently say no. Looking at saying, have you ever had backache or discomfort, and getting an idea of them disclosing that information is actually a positive trait compared to them saying no for everything. So are they complying? And when we were first rolling out the psychometric screening tool that we developed, one of the clients that we worked with, they used it as basically, we will look at it retrospectively from the clients that we worked with. And so some of the key findings were that, I guess, the failure to disclose in the musculoskeletal side of things, and then also overstating their abilities, being uncooperative with the test taking, but then also having low scales within the psychometric tool. And there were things, obviously, like terrible attitude, but workplace bullying, theft, not turning up for their first day, leaving after their first week, that correlated between the mental function but also the behavioural side of things, of how they're interacting with the actual pre-employment screening side of things, which they can kind of tell you a lot without telling you anything verbally. And our data suggests, and this is working with different clients and looking at their data retrospectively, is 7.5% of your premium costs and your severe injuries and the time that you're associating to dealing with them is 90% of your costs are coming from 7.5% of your workforce. There's certain things within there that are potentially never going to be eliminated: your slips, trips and falls, your assaults potentially by residents, and things in that nature. But there's also the ability, if we know that 2/3 of them are walking in with underlying issues, and then some of them have a combination of those, I've been able to screen to create a healthier, more productive workforce, less absenteeism, etc. So then the question comes, and this is something we hear time and time again, is how do you support the worker? And we'll look at this predominantly from the mental function side of things. And one thing that we're seeing across not just the sector but Australia as a whole is more people identifying the mental demands of a role. We've got a potentially younger age force. That's what the data is showing us, that the average age is trending downwards, with more people having to come into the industry and fill this high workplace demand. And unspoken expectations, it's a saying that I really love, lead to future resentment. And so you've got this person who may be coming in as a AIN for the first time, and they know potentially physically what the job entails, but they may not have been exposed to through placements or through experience to different things. We're seeing a lot of proactive clients that we work with either documenting this in their job ads or very early into the interview process, to be able to say, hey, look, here's physically what is going to be required of you, but also here are some of the things that you are going to experience in this role. That way people can either say, well, I didn't expect that, and expectations can then be reset with that person, or you're not getting 3, 6 months, 12 months down the track, and these people are going, I strongly dislike, I don't want to be in this industry anymore because the expectations haven't been necessarily met. And then the age-old adage of what gets measured gets managed. The question then comes, what do we measure and how do we manage it? Because it's quite hard to manage something you don't really know what you're measuring. And so we look at it at four different places within an organisation. So obviously at the organisational level, the department level, the role, and then at the individual level. So looking at it at an organisational level, so for us this is getting all those different subscales and being able to go, these are where the strengths as an organisation you have through the different areas, and these are where some of the weaknesses that you have as an organisation. At a department level, that may be significantly different to what you have at an organisational level, and being able to tailor and support teams in that sense is going to make a huge difference. Once these, I guess, baselines are sorted, it's, unless you're changing something about the actual pre-employment screening process, it's unlikely that the strengths and weaknesses are going to change too much over time. Particularly if you're hiring in large numbers, the laws of large numbers are going to stay relatively similar. But what can you do to support once you've identified these things? Is, some of these things are, I guess, more obvious than others, but manager training. If you know that there is poor receptiveness to feedback as an organisation, you may look at how can we improve the communication of our managers to then be able to counter that down the completely down the organisation. Different mental wellness initiatives, whether that be mental, physical, or social. Focus groups at each level, from an organisational level and at each department level. And then psychosocial surveys. Now, I like this as both a measure and a support technique to see if you are implementing, say, manager training or mental wellness initiatives, to actually see if they're having a true benefit within your organisation, rather than, hey, this sounds like a really good initiative, let's do it, and oh cool, we've ticked that box. Not only is it from an ROI perspective, but also, again, going back to a people side of things. And then if we go one level deeper, you have your departments. We've seen from one department and role to role significantly different strengths and weaknesses, from a home care worker to an assistant nurse to obviously a maintenance officer to a chef to an admin officer. Significantly different profiles of where their psychometric strengths and weaknesses sit. But just because you have it at a role level, I don't believe that's enough. If you look at, hey, this is what the profile is of the strengths and weaknesses of an RN, you might get an individual who comes into your organisation who has completely different strengths and weaknesses, and being able to identify and support those is, like I say, I think the most proactive and beneficial way of supporting it. So we have different solutions in general across different providers for being able to support these workers. One of those is obviously an EAP, which is great, but without, again, going down necessarily a rabbit hole, it's one thing that you've identified this worker may need support in that particular area. It's another thing getting them to use it. It's potentially a reactive tool that people use when they are stressed out or are having particular issues, more so than being necessarily a proactive tool. Again, psychosocial surveys, working them through an organisational side of things, and then all the way down to a role and an individual side of things, to be able to get a pulse on your workforce, to be able to pick up on trends and intervene at the earliest possible side of things. Team training, so this is again a flow on from the managers, let's improve the managers or the leadership and the culture, and let's work that way into our organisation with the team that we're bringing on. And this is a really interesting thing. We actually had a conversation with a client last week on the screening, not the workers, but improving or decreasing the risk or improving the workplace environment. And this was for some of their home care staff, screening not necessarily the recipients of the support, but the people that they're living with. So they're seeing a lot of the assaults and the issues that are coming, both verbal and physical, are coming from the family members that these people are living with. So being able to screen and then put environmental or workplace support tools in place to create a safer environment for your employees when they are going into these difficult environments. That may be a second person going with them. It may be just them being aware of different things, or it may be just having certain new rules and systems put in place. Not necessarily an easy solution, and whether this will roll out. We thought it was a really, really interesting discussion of, we talk about environment and workplace and the psychosocial risk compliance side of things, but we're often looking at the resident and the employee and the workplace as a whole, where there's these kind of subsidiary risks that are often potentially missed. And finally, and this is something that we've been working on behind the scenes, is e-learning tools. So being able to identify, and it's something we're really excited about, something to identify, like I said, somebody who has poor feedback receptiveness or poor learning confidence, or I shouldn't say poor, it's one of their weaknesses, but also identifying those strengths. And then when people are either inducted or on an ongoing basis, we're developing e-learning support tools that are specific to the role, not to the industry as a whole. So being able to give them examples, if they are an AIN, of conflict resolution, but with examples of things that they would actually experience in their day, rather than, hey, here's a way to improve your resilience as a whole for everyday life, which doesn't mean that we're necessarily not looking at that, but the ability to be able to identify, support, and then, like I say, track on the back end. So that's something that we've been working really, really hard at with a really experienced team, and we're excited over the coming months to be rolling that out with some of our clients to be able to identify and support these teams. And part of that, I know I'm seeing cards flashing up at the back that I've, as usual, spoken for too long. But we will be exploring some of these things in a round table, not necessarily what we're doing, but we're really excited to hear what a lot of you are doing in this space. So we'll be facilitating a round table later this afternoon that I hope, if this has been of interest, then you can come along to that. Otherwise, we look forward to chatting with you outside during one of the breaks. Thanks.
Are there any questions for Victor?
There's one over here.
Cool. I might invite Tom, our founder, up as well, who, if there's anything you might want to dive in with the answers as well.
Thanks for the presentation. I was really interested. I'm over here. I'm Camilla Rowland from Palliative Care Australia, and Ian Yates touched on this morning about some of the changes in aged care and did touch on some of the suboptimal areas, which includes palliative care. And as we know, part of the reforms are embedding palliative care in every aged care facility in Australia. So, in order to do that, one of the things that we need to ensure with our staffing is that we do address the fact that every staff member will be working with and caring for people who will be deteriorating and then terminal, so that we'll have less people dying in hospital and more people dying in their home, which is the aged care facility. When you were doing your research and your work and putting this together, were you looking at the factor of the impact on the staff, and how do you supervise and care for the staff who are every week, every day, caring for people who are deteriorating and at end of life?
We've looked at that in general terms in aged care because of obviously the stage of life that aged care is applicable to. We haven't looked at it though with the emerging trend that you mentioned of more and more palliative care being now part of the both home care and residential landscape. So yeah, look, we've in general looked at it, but one of the things we're keen to discuss with you this afternoon when we do our round table is your experience in that area, because we're here to learn as much as you are, and we're actually launching this, as Victor said, in the coming months, not just in Australia, and yeah, really excited to learn from each other what can be achieved in this space.
I think what I'd add is I mean, that's a great point for us to take into consideration, but being able to have this breakdown of like 7 different subscales, say for empathy, and being able to correlate, okay, where do these, say, e-learning modules or the support for these workers, if they are particularly low, I mean, obviously everybody could probably benefit from them when they're coming into an organisation, but being able to have, say, examples and support techniques, and then, you know, when they're coming into the organisation, to be able to say, hey, here's an example of something that you may likely experience soon into your employment. Here are certain things. Here's different support tools that you can use. Yeah, the EAP provider side of things that I mentioned. Yeah, that will help you be able to deal with these things as they arise. So yeah, not necessarily a certain answer. The short answer would be no, we haven't looked at it specifically, but I think, yeah, with what you've said, we definitely will.
Just a question over here, sorry, Alison from Hammond Care. I'm curious about to what extent the psychometric testing that you mentioned factors in cultural differences and the responses that people are going to give in those psychometric tests. There's definitely cultural behaviours that makes people respond differently, and to what extent is that accommodated?
Great question, and the tool has been, so as Victor alluded to, well over 100, I think it's 162,000 times now we've used it. It's built specifically for the post-Royal Commission aged care sector in Australia. So given that such a large proportion of your workforce is either English as a second language, a culture that may not be the mainstream, or what we might refer to as the mainstream, in that data there is so much from those that informs and builds the algorithms that essentially measure and then support. So yeah, very much so. Yeah, great question.
Yeah, I think the other thing is from the actual cultural, from applicants that are coming through, there are definitely trends that we see with different ethnicities, particularly people coming into the country, where it is generally they are prompted to not say particular things, or they won't say any particular things. That's where a lot of the forensic components of it have been developed, to say, is this person over representing their ability, or, and it's very rare in the pre-employment space, underrepresenting. It's more the malingering of people who've been injured and we've used the tool. And then again with the have they understood and have they answered honestly? So those forensic tools are very much developed for obviously an Australian workforce, but to assure that we're not screening people out for or misrepresenting their capacity based on the cultural side of things.
Thank you so much, Victor, for your really interesting presentation this morning.